For the convenience of internationally arriving patients, Bangkok Hospital has established a meet and greet counter at Suvarnabhumi Airport located at exit number 5. The counter facilitates pickup service to the hospital and can also register patients on arrival. Vehicles ranging from commuter vans to luxury limousines are available to provide transport for patients and accompanying family members. Our Bangkok headquarter campus consists currently of 18 buildings, including 3 separate JCI accredited hospitals: Bangkok General Hospital, Bangkok Heart Hospital, and Bangkok Wattanasot Cancer Hospital. Annually, the campus treats almost 1 million patients, of which approximately 230,000 patients arrived from over 160 countries. We have dedicated ourselves to delivering excellence in healthcare services through continuous improvement, advanced technology, and specialized tertiary care. Bangkok Hospitals handles emergency calls and medical transport throughout Thailand and the wider ASEAN region. To efficiently render emergency medical services, the ambulance fleet consists of mobile ICU, CCU, and stroke units, Hydrolance water ambulances evacuations from the islands, motor lances for fast response in congested city areas, as well as helicopter emergency medical services. For longer range air medical transport, Bangkok Hospital's flying doctors and nurses team up with a few select dedicated fixed-wings aircraft providers in the region to move patients safely from all over the Southeast Asia region. For our overseas visitors and expatriates, we have international medical service counters to welcome and assist with a wide variety of languages and cultures. For patient convenience, a team of interpreters has been assembled who are fluent in over 32 languages to ensure that communication is never a concern. For our patients requiring long stays, our Plaza Shopping Center on the hospital campus will make them feel at home. It consists of restaurants, a mini supermarket, bookshops, banks, money exchange counter, travel agency, medical equipment shops, flower shops, and a barber shop. Bangkok Hospital has a range of outpatient department clinics and rehabilitation services covering brain and spine, orthopedics, trauma, heart, and cancer. If a patient needs to be hospitalized, there is a full range of inpatient services, including admission services, help with insurance, and other third-party payer services. The hospital offers a variety of choices for inpatient rooms, including standard, deluxe, and superior rooms with international food options. Bangkok Hospital offers a full range of treatment including trauma, neurology, orthopedics, and spine. Bangkok Heart Hospital specializes in treating simple to severe heart diseases and conditions. It is supported by frontline technologies such as 256-slice multi-detector CT scan, cardiac MRI 3 Tesla, hybrid operation room, ECMO, Cardo 3D mapping. Wattanasot Cancer Hospital has years of expertise in treating cancer patients. It treats all patients under the concept of total cancer care, meaning early prevention, accurate and precise diagnosis, effective treatment, and full recovery. With a multidisciplinary team approach and cutting-edge technology, the services include oncology imaging and nuclear medicine, ambulatory chemotherapy care center, surgical oncology center, radiotherapy center, breast center, and blood and bone marrow transplant. For our patients who require surgery, services and facilities at the operating rooms includes orthopedics, breast, neurology and spine, gynecology, cardiac surgery and pain control, and anesthesiology. For our critical patients, the special intensive care units cover trauma and general surgery. neurology, medicine and respiratory, heart and intermediate, pediatric ICU, and NICU. Intensive care includes smart ICU to monitor vital signs in real time, ventilation, and drug administration. In addition, we have pharmacy satellite for intensive care with 24 hours EEG monitoring and ECMO. After receiving full treatment, our patients receive medicines dispensed by a robotic dispensing system with counseling given by clinical pharmacists, nurses, and nutritionalists before being discharged. Once discharged, our patients can return home safely.
อีกระดับกับประสบการณ์และความพึงพอใจในการรักษาโรคระบบสมองกระดูกและกระดูกสันหลังด้วยความเชี่ยวชาญเทคโนโลยีและการบริการที่พร้อมเติมเต็มชีวิตในแบบที่คุณต้องการอีกระดับกับการดูแลรักษาด้วยทีมแพทย์ผู้ชำนาญการรวมทั้งทีมแพทย์สหสาขาและบุคลากรทางการแพทย์ที่เชี่ยวชาญ
เราพร้อมจะดูแลทุกปัญหาที่เกี่ยวกับทางด้านสมองและระบบประสาทโดยทีมแพทย์สหสาขาเพื่อผลการรักษาที่มีประสิทธิภาพถูกต้องแม่นยำรวดเร็วและปลอดภัย
ที่โรงพยาบาลกรุงเทพอินเตอร์เนชั่นแนลศูนย์กระดูกและข้อเรามีแพทย์ผู้เชี่ยวชาญในเฉพาะสาขาออร์โธปิดิกที่มีความชำนาญเฉพาะในสาขาของตนเองที่จะให้บริการอย่างครอบคลุม
เราพร้อมดูแลรักษาโรคกระดูกสันหลังโดยทีมแพทย์ผู้ชำนาญภายใต้การรับรองมาตรฐาน JCI จากประเทศสหรัฐอเมริกา
อีกระดับกับ Center of Excellence ด้วยผลการรักษาที่มีประสิทธิภาพภายใต้มาตรฐานการรักษาระดับสากลพร้อมการดูแลองค์รวมแบบบูรณาการอีกระดับกับความปลอดภัยที่มั่นใจได้ทุกครั้งที่เข้ารับบริการอีกระดับกับเทคโนโลยีและเครื่องมือทางการแพทย์ชั้นสูงที่ทันสมัยเพื่อเพิ่มความแม่นยำถูกต้องปลอดภัยอีกระดับของประสบการณ์ด้วยการดูแลอย่างใส่ใจในทุกขั้นตอนเพื่อความพึงพอใจที่เหนือกว่าอีกระดับกับการผสมผสานศิลปะเข้ากับวิทยาการทางการแพทย์เพื่อผลการรักษาที่มีประสิทธิภาพโดยคำนึงถึงทั้งทางร่างกายและจิตใจเป็นสำคัญอีกระดับด้วยคอนเซ็ปต์ Smart Hospital เพื่อตอบโจทย์โลกดิจิทัลด้วยประสบการณ์และความพึงพอใจอีกระดับเราพร้อมแล้วที่จะให้คุณเติมเต็มชีวิตในแบบของคุณ Rediscover Your Life โรงพยาบาลกรุงเทพ International
Welcome to BDMS. We care, prevent, treat, and rehabilitate you by our professional medical experts, equipped with the latest medical technology and up to date through knowledge exchange, and ensure you'll be in the hands of our doctors in no time. We are BDMS, your trusted healthcare network. BDMS, trust in our good hands.
I was warned on Monday because of the seriousness of Fiona's condition that Medivac was a possibility. So on Tuesday, I'm not quite sure precisely when the decision was made, but I would say it was probably quite early on Tuesday that they felt that although Fiona's condition was stable and she'd been put on a ventilator and everything, she needed specialist care. I met Dr. Anrit, who is the emergency medical doctor on the helicopter who arrived that afternoon to assess her. And there was one concern that perhaps she was too ill, but I think bluntly I was told fairly clearly that if that was the case, then she would have died. So the decision to Medivac her, which I obviously signed something, was quite an easy decision at the end of the day.
We need to talk with the treating team, with the helpful. I would like to thankful to the Bangkok Samui Hospital as well that they planned a very good plan with us. They do the cathetoscopy, stop the bleeding, do the hemodialysis to make the proper condition, and we put the intubation together. The first thing we need to monitor the vital sign, the blood pressure and the heart rate, because the patient still have the breathing. So we need to make sure that the patient is not shocked during the flight. The second thing is we need to monitor the ECG with the many reasons, but one of the important thing for this case is patient have acute renal failure that might have the hyperkalemia as well. So we need to monitor that they have the sign of the hyperkalemia or not.
She was transferred from outside hospital because of the severe infection of the right arm. At that time, it's already complicated by multi-organ failure. She has sepsis, she has bleeding in the brain, subarachnoid hemorrhage, has a blood clot in the large vein of the brain, the sagittal sinus thrombosis, has seizure, has renal failure that has to be on hemodialysis. And she's unconscious at that time. She doesn't know what's going on at that time. After discuss with her husband, we're giving her 10% chance that she might make it. But in that 10%, we cannot guarantee how much quality of life she can be back to her normal. So her condition involves multiple specialty and subspecialties. She has renal failure that needs hemodialysis. In the term of neuro condition, she has seizures multiple times. She has to be on the medication to prevent seizure, monitor the seizure activities, and also the blood thinner for the thrombosis or blood clot in the brain. First of all, we have to stabilize her, make sure that she has no more seizures activities, take care of her brain, that she has a bleeding, and the most important is we have to get rid of the source of the infection that caused her all this complicated condition. So after she was stabilized in the ICU, we took her to the operating room to do the debridement, and also the antibiotics has to be started early. Nephrologist has to involve with the kidney failure that she has to be dialyzed, get rid of the waste product that she has. Infectious disease specialist to adjust the antibiotics to a proper antibiotics. Also the vascular point of view and the wound care has to get rid of the source of the infection. From the imaging study, she has very severe infection of the right arm. Look like she has to lose all the skin from her right arm. But with our evaluation, actually she has a focus of the infection in one part of the arm. We did the debridement focally, And the rest of the arm, we explore with small incision, which it showed that she doesn't have that severe infection as from the CAT scan. So we keep the skin of the rest of the arm and monitor it closely and take her back for the second look. We're pretty pleased that we don't have to take the whole skin from her arm out. So as a result, the patient doesn't have to lose the skin of the whole arm, just some segment that have severe infection, and which we can reconstruct after the wound get better with the skin graft, and it look more pleasing cosmetically, which make the husband and also the patient is very happy for the result. The challenge for this condition is she presented with very complicated condition. She has sepsis, the infection in her bloodstream, stroke, renal failure, and also very severe infection that she might lose the whole skin and of the arm, or maybe more than that if we cannot control the infection. Since infectious and vascular conditions do not involve only just one single organ, therefore, multidisciplinary team plays a major role to achieve the best possible outcome.
What I will say, it is life-changing because it makes you realise, it just makes you realise that when you go home every night, the only thing that matters is being with the people you love. It makes you value your life a lot, and I can't thank, I thank everybody here from the bottom of my heart for giving me another go at it. Thank you very much.
Because of the nature of her severity of illness, we have met a lot of experts, specialists at Bangkok Hospital in Bangkok, and I cannot fault any of them. They are clearly extremely knowledgeable about their professional aspects of their medicine. Can't say better than that.
Fabulous hospital. Thank you all very much.
Extremum ទីពេទ្យបង្កនឹង3ដងជាលើកទី3ចុងក្រោយនេះបាទហើយការធ្វើដំណើរមកពីកម្ពុជាបង្កនោះគឺយើងចាំបាច់គឺថាមកសម្ដៅមន្ទីរពេទ្យបង្កតែម្ដងបាទគឺខ្ញុំមកពិនិត្យដំបូងគឺឈឺថ្លើមហ្មងអត់មានឈឺអីទៀតទេបាទអាការៈមិនគឺព្រោះលើកទី1ដំបូងហើយលើកទី1គឺបោសថ្លើមវាធ្លាយបានគឺយើងមកសម្ដៅមកពេទ្យបង្កត់មកទាំងយប់ទៀតមកហ្នឹងបាទឡានពេទ្យហ្នឹងវាមានការចាត់ចែងជាមួយពេទ្យដូចយ៉ានៅកម្ពុជារបស់យើងហ្នឹងបាទលើកទី2គឺយើងមកបាញ់មកដុតបាទ
This patient, he came to hospital with abdominal pain. The pain seemed to be getting worse. After physical examination, we put in on investigation, that was CT scan. The CT scan showed a huge liver mass in his left lobe of liver. We also have multiple gallstones without evidence of acute cholecystitis. We discussed about the diagnosis that was hepatocellular carcinoma left lobe of liver and multiple gallstones. We need to have a surgery to remove all of them. We scheduled him for surgery. Earlier on the operative day, after surgery, he was kept in the ICU for half a day. His condition getting very good and be able to move back to the regular ward in half a day. Be back on his track and be able to discharge 6 days after surgery. This case might be not very simple case. He is old, 75 years old. He is diabetic, not very well controlled, but good enough for surgery. We detect his arrhythmia shortly before surgery. Luckily, it was under control. The plan of the treatment for this patient might be close follow-up. He got underlying liver disease, he got chronic hep C hepatitis. We do need to surveillance for the cancer if it comes back. At this stage, we ask him to come back for the follow-up every 4 months. Hopefully, the cancer might not come back.
ពីពូការជ្រើសរើសគឺជាទូទៅពេទ្យបង្កត់ដឹងស្រាប់វាល្បីដល់កម្ពុជានោះមានទាំងខ្ញុំម្នាក់នេះល្បីដល់ថ្នាក់ដឹកនាំរបស់ប្រទេសកម្ពុជាហ្នឹងក៏ព្យាបាលនឹងដែរបាទតារាសិល្បៈក៏មួយចំនួនដែរការចំណាក់អារម្មណ៍របស់ខ្ញុំគឺជាលើកទី1តាំងពីលើកទី1ដែលបុគ្គលិកក្តីហើយលោកដុកទ័រពេទ្យក្តីគាត់យកចិត្តទុកដាក់ចំពោះអ្នកជំងឺគាត់មិនជ្រើសរើសដើម្បីរកអ្នកជំងឺណាដែលគ្រាន់បើប៉ុន្តែជាទូទៅគាត់ព្យាបាលទាំងអស់ហើយខ្ញុំឃើញថាស្នាដៃក្នុងការព្យាបាលរបស់មន្ទីរពេទ្យបង្កក់យើងនេះវាជាជំនាញគ្រប់ផ្នែកតាំងពីបេះដូងឡើងទាំងជាតិស្ករឡើងទីពេទ្យយើងមានជំនាញវាច្បាស់លាស់ខ្ញុំវិញនោះឲ្យអ្នកដែលមានជំងឺដូចខ្ញុំក្តីលើសឈាមក្តីមានជាតិស្ករបេះដូងអីគឺឲ្យមកពេទ្យនឹងទៅម្ដងអរគុណចំពោះក្រុមការងាររបស់គាត់ទាំងអស់តាំងពីថ្នាក់ក្រោមរហូតដល់ដុកទ័រពេទ្យក៏យកចិត្តទុកដាក់សូមថាថ្ងៃអនាគតបើសិនជាខ្ញុំនៅមានការអាចទៅមកនៅប្រទេសថៃតទៀតខ្ញុំនឹងសូមមកជួបបុគ្គលិកទាំងអស់នឹងទីពេទ្យនិងលោកដុកទ័រដែលបានជួយសង្គ្រោះខ្ញុំហើយខ្ញុំអរគុណបំផុតចំពោះគាត់ដែលគាត់យកទុកចិត្តទុកដាក់ខ្ញុំ
ဒီရဲ့ခေါင်းထဲမှာလေအကျိတ်ဖြစ်တဲ့ခါကျတော့လေဖြစ်တဲ့ခါကျတော့ပုံရိပ်ကနှစ်ခုဖြစ်နေတာယောဂကတော့မန်းလေးဆေးရုံရောက်သွားတဲ့ခါကျတော့သူကဒီအကျိတ်ကတဲ့ယောဂရှာဖွေလိုက်တဲ့ခါကျတော့ MR တွေပါရိုက်ပြီးတဲ့ခါကျတော့အုံနောက်ရဲ့အနောက်ဘက်ချမ်းမှာတဲ့အကျိတ်နည်းနည်းလေးတွေ့တယ်တဲ့အဲ့ဒါကိုတဲ့မခွဲစိတ်ရင်မရဘူးတဲ့ကင်ဆာအကျိတ်မဟုတ်ပေမဲ့လေဒီအကျိတ်ကတနေ့နေ့ကြာရင်ကြီးထွားလာမှာတဲ့ကြီးထွားလာတဲ့ခါကျရင်ဒီမျက်စိအာယုံကြောတွေရောဒီနားတွေရောပါရွက်သွားတာရောအဲ့လိုမျိုးတွေဖြစ်နိုင်ချေများတယ်တဲ့အဲ့ဆိုအန်ဒီကဒီဘန်ကောက်ဆေးဆရာစီပြပြီးတော့မှအဲ့နောက်ပိုင်းကအန်ဒီကစိတ်မချမ်းသာတော့ဘူးအဲ့ဒီဘန်ကောက်အတိတယောက်ကဒီဘန်ကောက်ဆေးရုံကခွဲစိတ်တာရောဆရာရဲ့ဒေါက်တာတွေရဲ့နှွေးထွေးမှုတွေရောတဲ့ဆရာမတွေရဲ့နှွေးထွေးမှုတွေရောအကုန်လုံးကောင်းတဲ့အခါကျတော့အန်ဒီကဒီကိုလာဖို့ပဲဆုံးဖြတ်လိုက်တယ်လေ90ရာခိုင်နှုန်းထိကတော့အောင်မြင်နိုင်ခြေရှိတာပေါ့နော်အန်ဒီကအားကိုးတကြီးနဲ့လာခဲ့တာရှင်လာခဲ့တဲ့ခါကျတော့ဆရာနဲ့ပြကြည့်လိုက်တဲ့ခါကျတော့ဆရာတွေကအဲဆိုတော့ပြပြီးပြုတ်ပြီးအကုန်လုံးစစ်ဆေးပြီးတဲ့ခါကျတော့ဆရာတွေကဒီရက်ပိုင်းအတွင်းကိုခွဲစိတ်ပေးလိုက်တာရှင်ခွဲပြီးတော့မှဒီမျက်စိပုံရိပ်နှစ်ခုကလည်းလုံးဝပျောက်သွားတာရှင်ဟုတ်ဒီမျက်စိပုံရိပ်နှစ်ထပ်ပြတဲ့ဟာလည်းလုံးဝပျောက်သွားတယ်ပျောက်ပြီးတော့မှဒီခြေတွေလက်တွေကလည်းအကုန်လုံးကောင်းတယ်ရှင်အဲ့ဒါအန်ဒီကဒီဘန်ကောက်ဆေးရုံကို ဟိုတွေအားပြုပြီးတော့လာရတဲ့အကြောင်းရင်းအန်တီအတွက်ကတော့တကယ်ကိုတန်ဖိုးရှိရရှင်ခွဲပြီးတဲ့ခါကျတော့ဓာတ်ကင်ရမယ်ဆိုပြီးခွဲစိတ်ဆရာဝန်ကဓာတ်ကင်ရမယ်ဆိုပြီးအန်တီဓာတ်ကင်ဖို့ကိုဆက်လုပ်နေတာရှင်
This case is not a simple case because the tumor is localized at the area we call base of the scalp. In that area, you have many critical nerve, critical center that is really vital for our body. And we do have to design in the 3 dimension, which is the new technique that is the laser surgery or radiation therapy. This technique, we can give the very high dose to the tumor area and reduce the dose to the normal structure. That is quite difficult, but we have a lot of experience about this. The key success factor for this case is our multidisciplinary team. We have to discuss closely together with the neurosurgeon, neurologist, the radiation imaging doctor, and also the radiation therapy team. We have a lot of technique to cover with this kind of the tumor, but the best one now is to give the very high dose in the short time in the field fraction. This is called stereotactic radiotherapy or stereotactic radiosurgery. In this case, we successful because of our college, our team that we closely discuss together for the good planning for the patient.
အန်ဒီရဲ့မိသားစုတွေရောအန်ဒီရဲ့မိတ်ဆွေတွေရောအန်ဒီရဲ့အပေါင်းအသင်းတွေရောလုပ်ငန်းဘက်ကပေါင်းအသင်းတွေမှန်သမျှတွေရောအန်ဒီအကုန်လုံးကိုဟိုဒီဆေးရုံကောင်းတဲ့အကြောင်းကိုပေါ့နော်အန်ဒီခွဲစိတ်ပြီးမှဗမာပြည်သွားတဲ့ခါကျတော့ခွဲစိတ်တာအောင်မြင်သွားပြီလားလို့ကျမသွားတော့ကလည်းဒီလိုအကောင်းကြီးပဲပေါ့နော်ပြန်လာတော့လည်းဒီလိုအကောင်းကြီးပဲဆိုတော့သူတို့ကတော့လူနာတယောက်လိုပဲခံစားပြီးတော့မှလာမေးကြတာပေါ့အန်တီကိုလေဒါပေမဲ့အန်တီကလူနာတယောက်မဟုတ်တဲ့အတွက်သူတို့မှအံ့ဩမိတာပေါ့နော်ဟိုကြံတဲ့မိတ်ဆွေတွေလည်းဒီလိုယောဂမျိုးဖြစ်ရင်ဟိုကိုစီမာဒီလိုမကုနဲ့ဟိုဘန်ကောက်ဆေးရုံကိုဒါသွားကုလို့အမှကြတော့တကယ်ထိတွေ့မှုတကယ်ရှိတယ်တကယ်အောင်မြင်မှုတကယ်ရှိတယ်ဒီခွဲစိတ်တာရောအကုန်လုံးအဆဆအရာရာပေါ့နော်တကယ်အဆင်ပြေတယ်အန်ဒီအကုန်လုံးကိုကျေးဇူးတင်ပါတယ်ရှင်
ما علي مطول عليكم، الاخر شيء ان العمليه ما كانت ناجحه صراحه يعني، فرجعت الكويت، استمر معي تقريبا 8-9 شهور. اول شيء بسم الله الرحمن الرحيم، بدايه الالم اللي فيني كان في تقريبا 2010 وسنه عن سنه زاد الالم في عوار الظهر، كنت شايل اشياء ثقيله يعني، رجع الالم مره ثانيه. بعد سؤال فلان اللي حاشم ديسك ومني وين رحت وهذا، فرشحوني يعني صراحه اي تايلاند يعني، ولله الحمد يعني. عقب ما جيت تايلاند هنا، طبعا ما جيت تايلاند، طبعا سالت كثير ناس يعني اللي راحوا تايلاند، انا يعني ما كنت متوقع يعني كميه العدد اللي رايحين تايلاند، اللي مودي امه، اللي مودي ابنه، اللي مودي ابوه، اللي مودي حتى نفسه يعني رايح، حتى كانوا يجون حق يعني اسئله يعني فحص الدكتور يشخصون لهم يعني.
For this patient, Mr. Mohammed, gentleman of 50 years old, gentleman from Kuwait. He got operation of the lumbar disc number 4, number 5, 4 years ago. The symptom better in some degree, but he's still suffering of the pain in the back and the pain to the left leg. He have done the new MRI. The character of the disc protrusion is just like this. We call the recurrence of the lumbar disc protrusion. So I give him many choice of the treatment option. about the operation. But finally, we agreed together with the minimum invasive lumbar number 4, number 5, decompression and fixation and fusion. This is a revision surgery, so we carefully about the nerve. We use the microscope to decompression. The challenge problem is the surgical scar from the previous surgery. We give him the nerve monitoring in the operating theater to identify the scar tissue and to identify the nerve. And then we fix it with the minimum invasive surgery technique. We use the O-arm navigator to put the screw in the right position. Also, the O-arm can recheck of the position of the screw. We can finish this operation shortly, around 2.5 hours. So that's good for this revision case. This is one of the example that the patient who have the complicated problem of the lumbar spine surgery, even though the new case, I think that our technology, our skillful surgeon and team will help the patient. In our hospital, we have sophisticated equipment, microscope, intraoperative neuromonitoring, and O-arm navigator system to put on the screw in the safest way, and we can get the very good result like this patient.
أولا خليني أقول لك من أول ما بديت يعني صراحة من دخولي على الدكتور سرج، من التعامل معه قبل ما أدش على الدكتور تعرف الممرضات شلون يعاملون الواحد كأنه يعرفونه من زمان يعني ابتسامة. فلما دخلت على الدكتور سرج أعطاني 1 2 3 سويتهم فحوصات وكذا وهذا وكذا. بعد ما قرر عملية ولله الحمد سويتها صراحة يعني من العناية طبعا كما الإفاق وصحيت ليومك هذا أنا أتحدث والله بصراحة يعني يمكن أنا إن شاء الله عن قريب راح أغادر المستشفى. وصراحة حزين أخسر الستاف، يعني كافي المستشفى موفر لك يعني ممرضات يتكلمون اللغة العربية، يعني أعتقد سمعت أنا حتى يدخلون دورات لغة عربية لأجل راحة المريض العربي. فصراحة شكرا لبانكوك هوسبيتال، شكرا للدكاترة، شكرا للستاف، شكرا لجميع العاملين في المستشفى لأنهم صراحة أخجلوني في تعاملهم ويعني أحرجوني، فشكرا.